afternoon, everyone. My name is Raoul Kanafkana, and I'm delighted to be here today with you. I'm really thankful to my team, Professor Corsia, Professor Wursch, and Professor Blasco, especially for their active supervision for this study that I'm going to present you. It's part of my PhD actually ongoing. So I have no non-financial conflict of interest to declare, and the study was funded by the RSLR, for which I'm grateful. I have two challenges today. The first one is to keep your attention focused, and the second one is to provide to you a new point of view on ALS through the eye. So we'll try to do it together. Amyotrophic lateral sclerosis is a severe motor neuron disorder with increasing evidence of multi-system involvement, including the visual system at the level of the retina, but also at the level of the cornea. You all know that ALS is characterized by clinical heterogeneity and absence of definitive diagnostic tool, which make the diagnosis challenging and ultimately lead to an average diagnosis delay ranging between 9 to 13 months. So our question was, in vivo confocal microscopy might play a role for the diagnosis and prognosis of ALS. This hypothesis is supported by a study performed in 2014 by an Italian team who showed that some biomarkers can be found at the level of the cornea. So the objective of the study is to assess corneal nerves using in vivo confocal microscopy to identify new diagnosis and prognosis biomarker in ALS. We performed a prospective case-control study with age and sex matched controls between September 2021 and March 2023. ALS patients were diagnosed on the EI Escorial criteria, and we included both sporadic and familial forms. Systematic screening was performed for the two most frequent mutations encoded in practice, C9orf72 and SOD1. And all patients were enrolled at initial diagnosis before real-world treatment was started. We collected the usual data on ALS, age, gender, age at initial symptom presentation, site of onset, disease duration, ALS FRS revised score, forced vital capacity, and rate of disease progression. And for the ocular assessment, we assessed corneal sensibility using the corneal esthesiometer and corneal nerves using in vivo confocal microscopy. You can see on the left the picture of an ALS patient, the nerves. And we used after an automated algorithm called ACC-Metrix, it's a freeware, which allows you to identify several parameters at the level of the cornea. Nerve fiber density, branch density, nerve fiber length, nerve fiber area, nerve total branch density, nerve fiber width, and nerve fractal dimension. The study was approved by an ethics committee, and all patients provided informed written consent. Owing to no interocular difference across all parameters for the two groups, we chose the right eye for analysis. And statistics were classic. We performed non-parametric univariate analysis. So what about the results? First of all, no patient experienced adverse events while performing in vivo corneal confocal microscopy. This is an exam which is performed after anesthetic is instilled in the eye with an eye speculum. It's an important information. We included 20 ALS patients and 30 controls, a little bit more of male patients, and the median age was 71 in the ALS group, comparable to the control group. Most patients were diagnosed with sporadic forms, 18 patients, and the 5 remaining had familial forms. 7 had bulbar onset and 15 spinal onset. You have here the median ALS-FRS score, which was 41, ranging from 26 to 46 in the ALS group. And the rate of progression was also highly variable, ranging from 0.13 to 2.80. No significant difference between groups for corneal sensibility and corneal nerves was found between both groups. You can see here all the parameters we talked about just earlier, and all the significance above 0.5. Also, no significant difference was found when comparing corneal nerves parameters between bulbar and spinal forms. Correlations was found parameters and parameters of the disease, duration, ALS-FRS score at ophthalmic exam, rate of progression, and forced vital capacity, except for corneal nerve fiber area and ALS-FRS score. So, what was known? ALS is a motor neuron disease with multisystem features. We already said that. Previous studies have identified changes in corneal innervation in ALS patients. Actually, only 3 studies have been performed. One by the Italian team, we talked about earlier, and 2 others by Chinese team in 2022. And they also found correlations between corneal parameters and disease severity. The study adds important information. It's the largest European cohort to date, and we found no anatomical impairment in the corneal subbasal nerve plexus, which originates from the trigeminal nerve, directly from the brainstem. So it looks like corneal trigeminopathy is not a baseline feature of ALS. And this is a result which is in line with the absence of impaired corneal sensibility. We also did not find any correlation between the corneal parameters and disease parameters. So the clinical implication is in vivo corneal confocal microscopy may not be a useful diagnostic or prognostic tool for ALS. Still, other studies have to be performed on larger samples. Just to provide to you here an overview of the 3 other studies available, you have on the left the Italian study performed in 2014 and after the 2 Chinese studies performed in 2022. So we can see that the Italian study is characterized by a very small sample, only 8 patients, and all the studies found decreased length of corneal layers and increased tortuosity. An important point is that in clinical practice, we usually assess the central corneal nerves, but there is another structure which is located just infranasal to the central cornea, which is called the whorl corneal apex. And this is a structure you can see on the picture on the right, bottom right. They also assessed the corneal whorl and found that the length was decreased and there was increased inflammation in the cornea. The problem is that in clinical practice, it's very difficult to identify reliably the whorl in different patients. Sometimes you don't really see this spiral-like pattern. They also found correlations, significant positive correlations between the corneal length, the ILS-FRSR revised score, and with disease progression. So how to explain these differences? First, it can be related to ethnical differences. We have to acknowledge that our study was performed in European patients, while 2 other studies were performed in Chinese populations. And it is known that ethnical origin can influence corneal innervation. Second, methodological issues. We used an automated method, which is a method with better repeatability than semi-automated methods used by Fu et al. And Tiao et al., the 2 Chinese studies. And finally, we already said it, the study including Italian patients had only 8 patients, which is a small sample size. So in conclusion, corneal trigeminopathy does not seem to be a foundational characteristic of ALS. So in vivo corneal confocal microscopy may not be a reliable diagnostic or prognostic tool for ALS. Still, some additional studies are needed, and in our team we are investigating actually the composition of basal tears in patients with ALS. So the answer to my first question is it might be more a myth than a reality. Thank you for your attention.
Thank you very much. Any questions?
Sorry, but are you aware of post-mortem studies going into this issue of sensory corneal nerve?
Actually, we performed a review, which is under review, and there's no post-mortem studies on corneal nerves, but there are post-mortem studies on the retina, and with the TDP-43 aggregates, for example, in the retina. But probably it would be interesting to check the cornea too.
Just to comment first, thank you, Kanav, for choosing this study for your PhD. And the main comment is this: it is the first part of this study, and the main part of the PhD is focused on the metabolomic analysis of tears. So of course you can imagine that we only look at the anatomical part of the eyes, but the main part of the study is on the metabolomic approach on tears. And we are waiting for the result maybe next year.
By the end of the year, I think. I hope so.
Do you think that if there is a correlation between the abnormality you find about the sensibility of the cornea and the fact that some patients have dryness?
This might be an important factor because in the elderly you can have eye dryness, which can impact corneal sensibility. So we performed a comprehensive ophthalmological examination and ruled out any dryness of the eye. So no patient here has eye dryness.
Okay. Just wanted to know what about the evolution of the innervation of the cornea during the symptomatic stage?
Yeah, over the time, it's a very good question. Actually, we examined all the patient and controls during 6 months. So I presented today only the initial findings, but probably next year I'll present to you the longitudinal findings.
And is it a contraindication for the in post-mortem for the cornea transplantation? You know, when patient dies, most of time the only...
yeah, it can be for Creutzfeldt-Jakob, for example, disease, but not for ALS, to my knowledge.
Is it always permitted?
I think it is. Yeah. For ALS, yes, you can do it.